A very good afternoon and welcome to the session on the topic Understanding Infertility Investigations by Dr. Swati Shree. We are glad to have our doctor today to share all the important details related to the topic. So stay tuned till the last of the session. If you have any doubts, any queries, post that on the comment section so that our doctor can take all your questions by the last of the session. Also stay tuned till the last because we'll be sharing all the information and details about the topic as it's a very important topic. So I would hand over the session to the doctor. You have the stage.
Okay, thanks for the introduction. I'm Swati, consultant Apollo Fertility in Bangalore. So today the topic for our discussion is understanding infertility tests. So many a times whenever you meet a doctor for fertility queries, you are advised lots of tests. So you might be wondering why these tests are and what they are meant for. Many times you feel that why so much tests. So today we'll discuss in stepwise why these are tests and what are the importance of each test. So first of all, we have to understand what is infertility. So infertility is typically defined as the inability to achieve pregnancy after 1 year of unprotected intercourse. So once any couple is trying since for more than 1 year, that is called infertility. And if the woman is more than 35 years and they are not trying getting pregnant, if they have been trying for more than 6 months, that is called infertility. Then you, or if there is any reason which to suspect that there can be an underlying problem like irregular cycles, so these can be the indications for you to go for the fertility treatment. So now coming to understand before understanding the how infertility investigations are done and what are they meant for, it is important for us to understand the process of becoming pregnant. So in a female, the reproductive organ consists of the two ovaries, the uterus, and the fallopian tube. So the two ovaries are basically these are the reserves of the eggs. So they have multiple eggs which are there from the birth, and they get activated once any girl becomes attains puberty. So after the attainment of puberty, the eggs are started get activated and they start getting matured. So every month, what happens? Around 8 to 10 of eggs start getting matured in a cycle, and only one will become properly matured, and that is released from the ovary. So you can see here the ovary, this gets matured, and after maturing it gets released from the ovary. This usually happens at around 14th day of the menstrual cycle. So once it is released, the egg is released, the egg is being picked up by the fallopian tube. So once it is picked up, the same time if there is intercourse, the sperm also travels up. So sperms travels up all the way from through the uterus to the tubes to meet the egg at the tube. So when they meet in the egg, when the sperm meets the egg, out of the millions of the sperms, only one sperm basically fertilizes the egg. So when the egg enters the or fertilizes the tube, the egg which happens in the tube, the embryo forms. This embryo, this single cell which is formed, is going to form the future baby actually. So this from one cell, the two cell, four cell, eight cell, so, this division starts, and this the embryo travels down. It gets implanted inside the uterus or womb. So this is how a natural pregnancy happens. So now coming for the test. So test will depend upon any of these features. So whenever you go and visit fertility specialist, they will first give some set of the tests which are done for your general well-being. So like your blood group, your complete blood count to look for your hemoglobin. If there are any problems with any anemia, the blood count for infections are checked. So these are the some basic tests which is important for the general well-being, because for you to have pregnancy it's important for you to be healthy first. And then some hormonal screens are done, infection screens are done, and blood sugars are also checked. Others tests like liver function, renal function, and lipid profile can be checked if depending upon if there is any risk factors in you, like if there is any high blood pressure, any high cholesterol level. So if there is any other things which then other test can be done for to look for your general well-being. Now coming to the typically investigations for the cause of infertility. So what we have learned how the pregnancy happens, and in that step any problem if happens, any problem that develops in any part of this process can lead to infertility. So now coming to the causes of infertility can be like as you can see in this table, like uh, 30% of the infertility are because mostly because of the female factors. 30% can be because of the male factors, and there are 20% in which mixed infertility causes. That means both male and female factors are involved, and 20% are there in which unexplained. That means we have done all the investigations and we have not found any abnormality. That is unexplained infertility. So the infertility can be either from the female partner, either from the male partner. So any factors can be there, so we need to investigate the both factors. So now coming to the cause of female infertility, so it can be ovarian factor, like egg is not getting matured or egg is not getting released from the ovary, which is also called anovulation. So we can say it as an ovarian factor. Sometimes what happens, there can be a tubal factor, like tubes. The tubes are the portal where from which the eggs are carried, and also the sperm gets and meet in the tubes only, and fertilization happens in tubes only. So the tubes are also an important factor. So for any reason tubes get blocked, or tubes are just like a pipe of, you can understand, like a water pipe. If it is blocked, the water will not travel. See, or if there is any kinking in the way, and so then also the water will not travel. The same way the tube, if there is any kinking or any distortion of the anatomy of the tube is there, in that condition also it can lead to infertility. So tubal factor also forms the one of the factors, and others are like uterine factor. So any abnormality in the uterus, or any fibroid is there, which is involving the lining of the uterus or cavity of the uterus, causing some problems. Sometimes there can be some genetic congenital abnormalities of the uterus. So these are can be also responsible for infertility. And then comes the cervical factor. So sometimes there can be some cervical factor. There can be cervix can be very too much tightly closed, so as not to allow any sperms to travel up. So these can be also the causes of the infertility. Now coming to the male infertility. So there are certain factors which can also from the male partner can also be responsible for the infertility. So there can be sexual dysfunction, which can, like erectile dysfunction. So these can be there, which mostly is maybe there might be some underlying causes, and other are like there can be problems with either sperm. There might be less in the number, the sperms might be not the ability to swim up, or sperms may be little defective in structure. So these all the problems can be there. So all the investigations which are done to look for the cause of infertility are basically looking at these all factors and these all steps. So coming for the investigations, the first of all, what investigations mostly the doctors will say, other from those investigations which is done for general well-being, are like first is the pelvic ultrasound, and most commonly it is done by transvaginal. So most commonly the transvaginal ultrasound is done, in which the probe is inserted inside the vagina, so that the uterus is being seen very clearly. So in that, by that scan we can see this uterus very well, and ovary also we can see. So you can see it very well, that we can very clearly see how the uterus is, and the lining of the uterus we can see. So a uterus or womb we can see very clearly. And also in the our scan we can see for the ovary. So we can see this is the ovary, we can see the ovary very clearly. We can even see the follicles. These are the follicles, which are the fluid filled sac in which the eggs are there. So eggs are inside each of these follicles. So this is makes it makes very easier for your specialist to see and judge for the any cause of the infertility. Many a times by scan we can understand many things. And sometimes you might also have heard, or your doctor might also have advised about for the follicular monitoring. So what happens in that, we do the scan, it is done as a transvaginal scan, and in which we will do the serial ultrasound is done to see if this any egg follicles are growing or not, because as I said in beginning, the follicles have to grow, they have to mature, and then only they release the egg. So that is done, that is called follicular monitoring, because that gives an idea if there is any problem with the ovarian or follicular development and ovulation. So that we do basically by doing a serial scan, which is called follicular monitoring. Now, coming to the blood test, which we do mostly in the females, is like FSH hormone, LH hormone, and AMH hormone. So, what is these hormones? FSH is follicle stimulating hormone. So, it is the hormone which is responsible for the growth of the follicles or the eggs. So, this is one which is responsible for maturation, and LH is one which is responsible for ovulation. So, the eggs come out of the ovary. So, for that, the response happens once the LH hormone is released from the brain. And AMH is also one of the factors which predicts the ovarian reserve. So it says about how much eggs are left in the ovary at this point of time when we are doing this blood test. So it basically tells about the reserve, because we all know the fertility reduces with the age. What happens when that fertility reduces with the age? Because as in the beginning I said that the number of the eggs are there from the birth, so these numbers are keep on declining as the one ages. So the same as when the egg numbers are declining, the AMH value will also decline along with that. So that also gives us a good idea about it. Gives a good prediction for the ovarian reserve of the woman. And the next test which is mostly done is the tubal patency test on like for to look for the fallopian tube obstruction. So in that there are a variety of tests, but we for main our main aim is to check for if the tube is open or not. So there are a variety of tests, like I told, HSG is one of the tests, which is also called hysterosalpingography. On or in short, you might have heard from your doctor telling HSG. What is that test? So HSG is done, as I told, for to look for the tubal patency. That means the tubes are open or not. So what happens in this test? It is basically done as an OPD procedure. So in that, the woman has to lie down, and after properly cleaning and using the sterile techniques, one tube or an instrument is inserted inside the neck of the womb or neck of the uterus, which is also called cervix, and then we push a dye. And at the same time, when we are pushing the dye, an x-ray is taken from the above, so that x-ray, this dye is being picked up by the x-ray. So if the tube is open, this dye will move all through the tube and come out from the other end of the tube, so that we can do see in the x-ray film, and that gives us an idea about if it is open or closed. So this gives an idea about the tubes. So we can see that in this we have this is the dye has entered the uterus and has gone both sides of the tube, so it gives us an idea that both the tubes are open. In this you can see that the tubes have are the dye has gone both sides, but there is accumulation of the dye. That means the tubes are that both side tubes are little swollen, so they are not very healthy, they are swollen. That's why the tube dye has accumulated at that particular place in the tube and has not been able to come out of those. So this gives a little us idea about how the tubes are, if they are open or not. Now comes the next test, which is sonosalpingography. So this test is I basically done in the scan, the same as the transvaginal scan. Only thing is that the same way as HSG is done, the fluid is injected, but in that case, the fluid is the radio-opaque dye. In this case, the fluid is plain saline water, or sterile water, which is injected, and the same time we do the scan to see for the fluid going through that. So that is called sonosalpingography. Sorry. Another last test which is done is called lap and dye test, also called chromoperturbation or laparoscopic test. So in this test, sorry, it is basically laparoscopy. So we all know laparoscopy is a keyhole surgery. In that, 2-3 holes are made, and we see inside the tummy and inside the abdomen, and we see just how the fluid comes out of the tubes. So that is direct test. Last in the test are semen analysis test. It is the simple test in which semen are checked. So the sperms are counted and checked if it is the count is low or normal, and then sperm is checked for if they are looking normal, they are having head, neck, cap, and tail or not, and then the motility, that means are they able to move or not. This is also called semen analysis. Now, these are the important tests which we do for the basic evaluation of any infertile couple. Now, there are some other spatial tests which are not done on all the couple, but it is done when it is we find any abnormalities or in any of these, and we feel that any spatial tests are done, like in females we might need to do testosterone when we find find the testosterone is a male hormone which is many times increased in some of the females. Many times they might be excess facial hair growth or excess acne. That gives us an hint that we need to check for her testosterone level. Or if there is, if woman is having some breast complaints or breast discharge, then we can go for prolactin. Another is karyotyping. I will get back to karyotyping in later. First, we'll see for the males test. So in males, the other tests which are done are same way. If the count is very less or there is no count, then we need to look for the FSH and LH, same as the female. In males also, FSH and LH are the hormones which are responsible for the formation of the sperms. So we check what is the reason. To know that, we do FSH and LH and testosterone in them. Sometimes prolactin might be needed to do in them. The last test which I had left is karyotyping. So karyotyping is basically to check for the genetic makeup. Basically, there are 46 chromosomes in any human being. That is, in one cell there are 46 chromosomes. These are the basic genetic material carrying structures. So these are having lots of the genetic information. So out of 46, there are 23 pairs. So 23 pairs, each of the pairs comes from mom and dad. So there are 46 chromosomes. So half of this will go to the baby. So if there is any problem in this, that might be responsible for the abnormal formation of the sperms or abnormality in the eggs. So this also becomes important. Many a times there are females in whom we find that periods stop very early, at a very early age of 20, 21, or 18, like that. So in those cases, we might need to do for the karyotyping. Karyotyping is the test to look for the number of the chromosomes. So chromosomes are 46 in number in all the human beings. So that test may, and in out of the 46, there are basically 23 pairs. And out of 23 pairs, one pair is one which is responsible for the sex determination, that is male or female. So karyotyping is the one test which we can might need to do in some couples. So like this, there is XX, there are two chromosomes for X. This is the female karyotype. So in that, some cases we might need to do karyotyping, and in some cases even if we find some abnormality in the karyotyping, or if we are there are some features of some genetic inheritance we find, then some specialized genetic testing might be done after doing proper genetic counseling. So this is these are all the tests which we do in our general practice and our general day to day evaluation of the infertile couple. So from the beginning, it's very important, because whatever the tests are done, they all our tests are based on whatever normal physiology is happening inside the body for to have a pregnancy or to have a baby. So at any step, if there is any problem that can cause infertility, so we need to look at each and every step. And it's not the one partner, it's not the only female partner, it's also the male partner. So when evaluation has to be done, evaluation has always to be done as for a couple. So that's all about the in the understanding of the investigations. I hope you can understand a little bit basics what I tried to tell. Is there any questions? Okay. So I guess there are no questions. So I will close this session. Thank you. ज़्यादा फास्ट बोला क्या मैंने?